Everybody wants to know, what is quantum RF? Can you break it down so it's simple for everyone to understand?
Sure. Yeah, quantum RF is a new technology here at Concierge, and it's a radiofrequency-based technology where a probe is introduced underneath the skin, and it provides deep dermal tightening to the skin for a nice tightening and contraction effect. This technology also has the capability to melt small deposits of fat. So for those patients who are coming in with maybe a little extra submental fat, for example, underneath the chin, or small areas of fat on the body, arms, legs, abdomen, this is a great option for those patients.
That's wonderful. So what can they expect when they come in for the actual treatment? What's going to happen?
Sure. So with a procedure like this, it's going to be more involved than your standard med spa type treatment. Typically, a patient will receive a local anesthetic type of numbing injection to the treatment area, and this will provide both a numbing effect where the device will then perform the skin contraction and fat melting.
So I think people call like EndoLift, Fiber Lift, Renuvion, J-Plasma. Are these similar devices, and how is quantum different from them?
Sure. I would say quantum is probably going to be more similar to the Renuvion, J-Plasma technology.
Okay.
Both are radiofrequency based. The main difference is that quantum RF is not using any sort of helium type gas in the technology. What quantum is doing is it's delivering pulses of radiofrequency underneath the skin at very high temperatures. And what that does is it safely distributes the energy throughout the undersurface of the skin, as well as provides that contraction effect.
Okay, so it's kind of like shrink wrapping the skin back to the muscle. How exciting. So who would be an ideal candidate? Like, give some examples of when this treatment is good and who should have it.
Sure. I would say ideal candidates for this are patients who have, mild to moderate skin laxity, maybe folks who have just lost a little bit of weight, maybe moms after delivering children.
That's me.
And anyone who's looking for some improvement in overall skin laxity, like in their abdomen, maybe in their under chin area, trying to reduce fat in that area, those are all good candidates. This can be a great technology to use in conjunction with something like surgery, like liposuction surgery, or even after surgery with patients who maybe just have small areas they want to touch up. Not a bad option for those patients with not a lot of downtime.
Sure, so they don't have to have liposuction to do this. It could just be tightening the loose, lax skin.
Correct, yeah. So patients who are just presenting with a little bit of skin laxity and just, small amount of fat that they want to get rid of, not really necessary to have the liposuction surgery. Now, for patients who are maybe presenting with a little bit more adiposity, it may be better in combination with something like a liposuction surgery.
Sure, so both. So you don't have to renew. Great, I love that. That's a great option.
It's a really nice, safe option to use that's radiofrequency based.
Yes, and so when, like, say we're doing an abdomen, you are gonna go underneath the skin with this probe. It's gonna tighten everything. Is there anything else that you sometimes pair it with or do in conjunction with?
Absolutely. So on this platform, we also have our Morpheus 8 technology. Morpheus 8 is a radiofrequency stamping technology where it can provide nice superficial skin contraction and texture improvements. So it's a perfect pairing to do at the same time as a quantum RF procedure to not only get deep dermal tightening and contraction, but also superficial skin quality improvement.
So you're like attacking it from both sides.
Absolutely, kind of sandwiching the skin.
Yeah, externally and internally.
All with the same device.
Very cool, I love it. So last question, because I know people are gonna ask, what's the downtime look like and how do they prepare for one of these treatments? Is there anything special they have to do?
Yeah, so overall downtime is pretty minimal. There's going to be some swelling after the procedure, and a lot of that is due to the lidocaine that we have to inject to perform it.
Okay, makes sense.
After several days, that swelling will go down. A lot of times it may be paired with a compression garment. So, for example, underneath the chin, we may provide a chin strap type garment to help not only alleviate the swelling, but also provide some contouring benefit that first week. Same if we're treating an area on the abdomen, the legs, the arms. Compression garment can be very helpful in improving the contour there. The overall, incision points that are made for this are typically made with a small needle that you might use about the same size as what you might donate blood with.
So tiny.
So oftentimes sutures really aren't even necessary. We would place Band-Aids over the areas and leave those on for a couple days, but afterwards, we usually remove those after the first week, see how you're initially recovering, and then patients are free to resume their normal activities as they can tolerate. I think the benefit of a technology like this is that since we aren't removing any skin or tissues, patients can really start to increase their activities even up to 48 hours after the procedure.
Well, that's nice. I love that. Well, if you want to find out if Quantum RF is right for you, schedule your consultation today.